webinar focusing on the call for twinning, so Digital Health Europe. My name is DigitalHealthEurope, and I'm sitting here with Daniel Schmidtmann, Veli Strottmann from Empirica, and we also have on the line Birgit Morlion from the European Commission. We would like in the next 30 minutes to go through the twinning scheme with you and then allow for some questions and answers. If you can just use the chat to indicate that you are hearing us well and that all is fine, then we can start the webinar. Okay, great. So we will begin with a short welcome by Veli, followed by Birgit explaining how the twinning scheme relates to the key European Commission priorities. Daniel and myself will introduce the twinning scheme, and then hopefully we'll have enough time for some questions that we can try to answer ad hoc, but also collect questions and then provide the answers later on.
Thank you, Strache. Good morning, everyone. My name is Veli Strottmann, as already announced, and we here at Empirica are coordinating the so-called Digital Health Europe project. This is a coordination and support action in Horizon 2020 with a duration of 2 years. It started in January this year and will run until end of December 2020. And this project is supporting the so-called Digital Health and Care Innovation Initiative in the context of the Digital Single Market Strategy. Our project officer, Birgit, will introduce you to the 3 priorities of the communication of the Commission from April last year, where these 3 priorities are elaborated. Our consortium consists of 17 partners, in addition being supported by more than 50 so-called associated experts. You can see here the logos of the partners. Next slide, please. This is a complicated diagram showing a higher level view of the activities of Digital Health Europe. It used to be even more complicated. This is how we try to simplify it, but please do not look at all the details. It is to show to you that the central activity is the twinning. The twinning actions is more or less in the center, in the middle of the diagram, but it also shows that the twinning activities are there to support also or respond to the 3 communication priorities, the communication of the European Commission. And the Twinnings will also provide input to inform those initiatives on the 3 priorities, but will also receive contributions and support from the project as well. And all of this will feed into recommendations to the European Commission and policy decision makers at the end of next year. So this is so far all to say.
Okay, good morning. My name is Birgit Morlion, and I'm responsible for this Digital Health Europe project within the European Commission in DG Connect in the unit e-health, well-being and aging. And this project will help us in implementing the communication which we published in April last year and is entitled The Transformation of Health and Care in the Digital Single Market. And it's looking into the potential of digital applications and data in the digital health and care area. So we see that there are a lot of digital tools, digital pilots, services, a lot of possibilities with digital technologies in order to support patients to keep us healthy. But we don't see them very widespread within the medical practice. And that's essentially what this communication is focusing on, is how can we help upscaling and implementing digital technologies and bring them really at the doctor's practice, in the clinics, to you as a citizen, to keep you healthy or to control your disease. And one of the instruments that we have already been using in the past is Twinnings, and that's an important tool to exchange knowledge, experience, and to help each other to fully benefit from the digital possibilities, and that regions or organizations that have positive experiences with integrating digital tools in their medical practice can share these experiences, can share how they did it, what is important when you implement it, and they can share it with other organizations, regions that are looking for getting more digital in their care and health processes. So that's why an important part of this project is focusing on Twinnings and helping you in implementing and benefiting from our digital society also in the domain of health and care. And this infographic that you see here is showing the 3 priorities of the communication on the digital transformation of health and care. And they're probably not a surprise, because these are the major things that citizens expect. They want to share their data, they want to transfer their data, medical data, with doctors, but also when they're abroad on holiday, they want to have access to their medical data. And most people are willing to share data, only it's not yet possible in several countries. And so that's the first priority. It's secure access and exchange of health data. Then the second priority is also about health data, but is more health data in favor of stimulating research, of moving towards more personal medicine, and make data available for future research projects, and linking research infrastructures that already have a lot of data gather already a lot of data, connecting them throughout Europe. And then the third one is digital tools and data for citizen empowerment and person-centered healthcare, and that's looking towards integrated care, moving from institutionalized care to home care to integrated care, and all the challenges of sharing and exchanging data that comes along with that, and also the mHealth and all these kind of fancy apps and watches that are available to track our body parameters. So we really call upon you in these 3 domains. If you have good practices, if you have implemented use cases that are that fit one of these 3 domains, please become an originator, as we call it in the Twinning scheme, and help other people, other regions that can benefit from your knowledge to become an adopter of your practice. And we really count on you to make digital health come true and to help us in making the health and care domain much more digital. Thanks.
Thank you very much, Birgit. Then now we move on to introducing the scheme.
Yeah, good morning, everyone. Can you go to the next slide? Yes, thanks. So I guess most of you are here to learn about the Twinning scheme, the DigitalHealthEurope Twinning scheme. And well, generally speaking, what are Twinning? Twinnings are a method or a mechanism of transferring knowledge. And the DigitalHealthEurope scheme is a support mechanism for scaling up and transferring knowledge in innovative digital solutions, therefore accelerating fulfillment of the communications priorities, the 3 priorities you just heard from Birgit. And what DHE, I will shorten it, I will abbreviate it, does is provide funding to enable the transfer of these innovative solutions. And you can see the scheme down below. Twinnings in general are between an adopter and an originator. So the originator has an idea or a product or a digital solution, and the adopter wants to adopt this product or whatever it is. And DigitalHealthEurope provides a platform or a place where this can happen, and also provides the funding. And in the end, what this will lead to is new capacities. If you continue on the next slide, Twinning solutions, like I said, in the DigitalHealthEurope realm, are concerning digital know-how, which is transferred through the twinning activities. And twinning activities may include, for example, hosting meetings, organizing technical groups, traveling, acquiring licenses, paying fees for professional services. And these topics must be based on digital technologies. They must be innovative. It should not have been used in the adopting region before the twinning takes place. In general, possible topic areas concerning the 3 priorities can be found in the call document. It's a rather long list, so I'm not going through this right now. But what I want to expand a little further on is the 4 types of twinnings. You have knowledge exchange and training. This targets usually local authorities with little experience with EU networking. And in this case, twinnings are seen as a first step to discuss a concrete solution, which could be a product, a service, or something else, and how it can be transferred to the adopting region. The capacity needed is built during the twinnings, and this includes identification of appropriate staff, setting up a process roadmap, defining expected outcomes, etc. The next step or the next type would be the adaptation. And this means if you as an originator already have an established solution, and as an adapter you want to adapt this solution to your country or to your region, then it means adaptation of the solution in terms of changing the language or making it suitable for your specific area. The adaptation process is across various adapters. So if you're adaptation, yes. The adaptation process is across various adapters, and it means it's possible to do this with one originator and multiple adapters. The next type is partial adoption, and partial adoption means that the twinning helps to partially adopt a digital solution that will have to provide concrete evidence on impact on the adoption. So basically, partial adoption means if you have a solution and that's been, or that will be adapted by somebody else, or sorry, adopted by somebody else, then you have to provide concrete evidence. The last and the biggest in twinning would be full adoption or acquisition, which means that the solution that will be adopted by a region has to be adopted fully into, for example, an existing local infrastructure, or which could mean you would have to do technical adaptation, or it could also mean that you acquire a solution by buying it, by licensing it from others, from the adopter. Yes. And if you are interested in one of these 4 types, or if you're an originator, you have a product or solution or a methodology or an idea or something, then you can go to the online marketplace as an originator and tell everyone about your solution. Or if you are an adopter and you are interested in learning something new from somebody else, then you can also go to the Twinning marketplace, which you can find at the Digital Health Europe website. And in that marketplace, we hope to establish a platform where originators and adopters can come together if you haven't yet found an interesting solution. Here's the overview of the budget. In total, we have 932,000 euros at disposal. And you see on the left side, you see the 4 types of twinning. And on the right side, you can see, for example, knowledge and exchange, the smallest budget, 5,000 euros per twinning. Then adoption is 9,500 euros, partial adoption 17,000 euros, and a full acquisition can be up to 43,000 euros. Yes.
Okay, so the way the scheme is implemented is by ways of competitive twinning tendering process. So that means that you apply and then are evaluated as an applicant against certain criteria that are in the document, in the call documents: exclusion, selection, compliance, award criteria. Then you are being ranked, and based on the budget we have, tenders or twinning tenders will be awarded contracts until the remaining budget is insufficient to fund the next twinning. Participation in this twinning scheme is open to legal entities established in the member states of the EU, but the focus is really on local, regional, and national health and care authorities who wish to twin, to transfer innovations from one place to another in Europe. Twinning activities must involve, as Daniel pointed out, this is a must have a digital element, a digital know-how, and this must be transferred to at least one twinning adopter. As Daniel mentioned, it can be more than one adopter. Actually, this is something that we welcome. We welcome multiple adopters, and this is reflected in the evaluation criteria. The more adopters, the more interesting the twinning is, and the better it could be scored. The twinning originator and twinning adopter, another condition is that they have to be from different countries. And in case of multiple adopters, then obviously it's enough that one of the adopters is from a different country than the originator. So submission of the twinning tender should be done by what we call a twinning contractor. So this is the sole organization that will be in contact with the so-called acting procurer. This is, in the case of this twinning scheme, Empirica, the coordinator of the Digital Health Europe project. And a twinning contractor can be any party, either the twinning originator or the adopter, or even a third party. In terms of funding of costs, we are very much in line with the Horizon 2020 eligibility rules. So if you're familiar with them, then this should not be a problem. We can reimburse personnel costs, we can reimburse direct costs, such as travel and equipment, and subcontracting. And if you want more information, I think going to the Horizon 2020 guidance documents on costs should be helpful. You have probably already downloaded the call documents on the website. So there are 5 documents that you have to look at. The main document, TD0, is the main request for tender, including all the information about the twinning scheme. Then you have 3 applications that must be used if you want to submit a twinning, administrative, technical, and financial sections. And then we have 2 draft contracts just for you to get an idea of how the contracts might look if you are awarded a twinning. So we are working on this. They are draft contracts, but just to give you an idea about the implementation through contracting. If you want to submit a twinning, you have to send to us the 3 documents, TD 1, 2, and 3, the different sections, via email to email specified, as you can see here, by the deadline specified in the twinning documents. And yes, we just ask for naming them accordingly as suggested here. As said earlier, twinnings will be evaluated. We're currently preparing the evaluation. They will be evaluated by an independent team against criteria. Especially interesting, of course, is the award criteria, which also gives you some indications about the expectations from this twinning. We have assigned a price-quality ratio of 70 to 30, so the award criteria that you see on this slide will be weighted with 70%, and then the price that will be offered in this competitive tender will be weighted with 30%. Twinnings will be ranked and then awarded based on available budget. We expect to award twinnings and announce the winning tenders on the 16th of September. And you have already seen the twinning calendar. There are different durations for the different twinning types. So, for example, knowledge exchange and training has a shorter duration, whereas full adoption and acquisition twinnings can last up until the end of August. More info on expected outcomes per twinning type, as well as deliverables that need to be submitted if you win the tender, are available in TD0. And with that, we're through. We hope that this gives you a good overview of the twinning scheme. Before we go to the round of questions, just to point out that we have a second webinar will be organized on the 25th. We're just deciding on the actual time of the webinar, but the next one will be organized on the 25th. And if we see the need for more, we are also open to organizing more webinars. Questions can be submitted either currently, as we are doing, via the webinar or using the email indicated in the twinning documents. We're collecting questions and then we'll publish a question and answer document on the website in due time. So another disclaimer is that we're taking questions live now, and we'll try to answer as much as possible from them right now ad hoc, but these are just indicative answers. You have to wait for the official answers that will be published on the website. I suggest then that we try using the functionality supported by GoToWebinar. So you should be able to see in your panel an option for raising a hand. So if that's possible, and if you have a question, please raise your hand. Hopefully we'll be able to see here who is raising their hand, and then unmute you to pose your question. I also see that some of you are using the chat functionality. So we'll start first with the ones who are raising a hand. So I see Celine. You should now, so please go ahead.
Can you hear me? Can you hear me?
Yes, we can hear you.
Okay. I don't understand the price criteria because you want to compare, if you want to see that it's a good price, but how can you compare if the solution is unique?
There's an echo, but can you repeat the question? It's about criteria.
It's a price, the criteria price. How can you evaluate this criteria if the solution is unique? You cannot compare the price with the solution, with the digital solution.
comparing the different tenders when evaluating. This is just to enable us, in case we have many twinnings, to be able to select twinnings that are promising, that are innovative, that match these award criteria, because we have a limited budget, we have limited funding. So that's why the award criteria are in place. It is not to compare twinning.
Okay.
Okay, let me see. Any other raised hands? Okay, then we'll have also a look at the chat questions. So one question by Maria Fellner: may the digital solution already be used in a prototype version in a research project? Yes, but it depends. So the rules we have are that we're obviously giving funding through the Digital Health Europe project. So we need to avoid double funding. So I'm not sure about the specific case that you're pointing out, but double funding should be avoided. And then if it's already tested but not implemented yet, that I think is pretty much in line with the scheme. It depends really on whether this is an ongoing project, whether in the project you're planning implementation anyway, and then this scheme should not be applied because it will lead to double funding.
And it depends on the maturity of the prototype version, because if it is just tested for feasibility or a little bit for usability or other similar criteria, that may not be sufficient, because you may fail the criterion of providing sufficient evidence that it is working and it can be implemented and it can be scaled up. So this may lower your chances on several of the award criteria.
And there's another question about whether more than one twinning is possible. I guess participation of your organization. Yes, that's possible. It's somewhere in the documents. I will just go very quickly in the participation rules, but so an organization may participate in more than one twinning tender, as long as the twinning solutions and the activities that you are planning there are significantly different. Obviously, it has to be a different digital innovation that you're looking at. Okay.
And I hope it has become clear that the same organization can be in one case originator and in another one adopter of a digital solution.
Another question: do you expect only or mainly authorities as Twinnings, such as in the Scala Hub program? Yes, the Twinning scheme is focusing on health and care providers broader, and they can be local, regional, national level. So yes, this for sure is the focus.
But of course, if there is a very wide community center connected to larger hospitals, that might be again a possibility. But in any case, there should be kind of agreement with authorities, some kind of local, national, regional authority, that this is a viable case.
Okay, so another question is, which technology readiness level will be the best for such a project? It really depends on the type of twinning. So obviously with full adoption type twinnings, we have higher expectations that the innovation needs to be transferred, whereas knowledge and exchange training is an exchange is about really doing that and not more. So it is hard to say. It depends on the type of twinning, but we haven't specified technology readiness levels. We have this as an award criteria, so maturity of the innovation is part of the award criteria. It needs to be mature enough to be able to be transferred. There needs to be evidence that this is even possible. That's why we also have the different types. Depending on healthcare systems, you might be able to achieve partial adoption. Constraints of healthcare systems might lead to that. And this all needs to be explained, your choice and why you have done this, you have chosen this twinning type needs to be explained in the technical version.
But it's a good idea that we should be looking at the technology readiness level, and if we consider appropriate, we will introduce those, add them to the tender document. If it is real use to applicants to have also this kind of information.
Then there's a question, can a healthcare center apply? Well, in my view as a healthcare provider, healthcare centers are healthcare providers. So I think this is possible. Is there a maximum number of adopters? No, we have not given a maximum number. I don't understand the price criteria. So the idea is that the prices listed or the budgets listed are maximum budgets available. And because we expect, also from the preparing the scheme and talking with stakeholders across Europe, we expect many applications. We have a limited budget, so we need to somehow rank tenders and select tenders up until the remaining budget is used. So that's why we need a price-quality ratio. And part of it is the award criteria, which is the quality part. And then the other one is to get offers that are competitive, that reflect the market.
On the maximum number of adopters, it's correct, we have not set a maximum, but do not assume that the more adopters, really much better in principle. Yes, this is correct, but it has to be seen in the context of meeting all other criteria, of course. This is just one out of several quality criteria. It's very important, but not the only one.
A question that maybe also Birgit can help us. Question is about whether there will be another twinning call in 2020.
Yep. For the moment, it's not foreseen unless we don't reach the maximum budget that's foreseen in this twinning call, so we don't have enough eligible or suitable proposals to consume this call. We might consider having a second call on this budget, but for the moment, there is no other project or no other call foreseen in 2020.
Okay, thanks Birgit. One question here is about whether a healthcare provider can participate if they're collaborating with other healthcare providers in a European reference network. Yes.
Yeah.
Well, yes, as long as they're from different countries, I think that would meet the criteria detailed in the call.
And it should be ensured, of course, again, that there is no double funding. But we could go into this question if there are no other hands raised. Just checking.
Could IT providers be originators or best subcontractor to originators?
Not originators, but they can be involved in the ecosystem of the originator.
Exactly. Typically, a healthcare provider as originator has a solution that might be very dependent on an IT provider they're working with locally. So the team of the originator might need to be including both organizations, because the IT provider will bring in the technical expertise, let's say a knowledge exchange training on a more technical level. So as Veli said, they can be part of the originator. So there is a question about whether the twinning will be accepted if you have adopters from Europe and worldwide. So the scheme is focusing really on adopters coming from the member states. We want the transfer of innovations to really boost the European dimension. And another question related to that, whether the participants need to be awarded the status of reference sites of the European Innovation Partnership on Active and Healthy Aging. No, that's not a requirement. Participation is open to any legal organization as we specified in one of the slides.
Okay, there's a question as well about the topics, called topics. Can we briefly go into this? I guess the question was to briefly explain those. These called topics are directly, actually, very closely related to the 3 priorities of the European Commission communication that Birgit presented at the beginning of the webinar. The first priority, citizen secure access, sharing of health data even across borders. You can see that this priority does not include too many, at least not that many potential topics as the other 2 priorities, and in particular compared to priority 3, because of the limitations posed already of the requirement across borders. Here in the first topic, we have listed examples for solutions that can provide for secure access of citizens to their health data. The second topic is also related to specifically interoperable solutions, and it's very important that sharing of data has to prove that GDPR, General Data Protection Regulation requirements are fully in place. The solutions need to prove that they are GDPR compliant, and have to address all of those solutions, all those topics have to address this security aspect. What else? Can you just, for a moment, the last topic listed, citizen-controlled data governance, health data cooperatives, different models for health data donation. This is, again, a topic where you have to provide sufficient information on how the model is functioning, in sense that the citizen is in full control of their own data, and provide evidence that citizens are also comfortable with the solution. Next one, as you can see, we have foreseen everywhere that there might be other relevant topics because our list cannot be exhaustive. These are examples of solutions that are mentioned in the European Commission communication or further European Commission documents in directly addressing the three priorities. But of course, we left here some room for further solutions, but it needs to be really proven that they are relevant for the particular priority, and they have to be very well described and elaborated. For the second priority, this concerns naturally infrastructure in place for personalized medicine, for instance, good practices in digital genomics, good practices in using real-world data, in particular also related to issues of data quality. This needs to be addressed in such applications. Examples of health data analytics, big data, etc. are also relevant as interoperable disease registries and sharing across borders as well, sharing of data for different purposes. Then in the third priority, you clearly see that this is the widest field actually, and we have tried to provide at least a simplified structure of topics which are citizen or patient focused, and those that provide good solutions for care practitioners, meaning not only health care but also social care. And this is both parts include a variety of topics. I don't think we really need to go here into the details unless there are some concrete questions around those topics, because these two parts are quite exhaustive. All kinds of telemonitoring solutions, addressing also digital health literacy and health systems, even robotics is part of this. Different approaches to integrated care, and in particular also including integration of health and social care services, and several others. And I would only like to underline that we have included here solutions for frailty and false prevention, but also e-learning to support the introduction of integrated care. Good.
The Twinning Originator, you can have a look at this list and see how your solution relates to these priorities, and if not, even, you're free to explain in your application how the solution relates to the priorities, even if they're not listed here. And as a Twinning adopter, maybe you have your plans and strategies that relate to some of these solutions. For example, on the marketplace, you can ask for a call for solutions that relate to your priorities based on your agenda and your strategy plan for the region or for the within your healthcare system. Let's have a look again at the questions, whether we have any new questions or we've answered all of them. Okay, so back to the question related to the IT provider participating. Does it mean that an ecosystem can be a twinning, or does it have to be a legal entity that takes the lead? So I think the twinning scheme has the mechanism to allow, for example, a Twinning Originator to subcontract an IT provider. And this is one way that we see it possible. The twinning contractor itself that we will work with here at Empirica needs to be one legal entity. So it's similar to a Horizon project where you have a consortium. So the twinning contractor is the leader, the coordinator, responsible for the overall financial and administrative aspects of the twinning, and then it is up to you how to organize this within the twinning. We have adopters, we have originators, and we have the option of subcontracting.
Right. And the ecosystem as such must be very well described in the application, but it is not a legal entity usually. So we really need a legal entity in order to organize the contractual issues and sign a contract.
A question on whether we foresee any ceiling on the way the number of priorities will be supported. No, I don't think this is foreseen. So we don't favor priorities in this case. We're just focusing on the total number per twinning type. Okay, any other questions? I see Natasha wants to speak. Natasha, can you?
Yes, hello. I work for one of the European reference networks, and so I just wanted to confirm that would it be okay if one of our HCPs was the originator and you had a solution that we'd like to make ERN-wide so that our other HCPs can also use this technological solution? But it keeps within our ERN, or would it have to be something that can also be extended to outside of the ERN?
Well, as long as the healthcare providers are from different countries, that is fine.
Yes.
I'm not that familiar with the reference networks. For the twinning scheme, it doesn't matter what the entity of a reference network is. It is about organizations participating jointly in a twinning, being represented by a leader called twinning contractor. So based on what I could hear, I think this should be possible.
Okay, thank you.
Okay, are there any other questions? If not, then I guess we can conclude the webinar, and would like to thank you for attending. The webinar is being recorded and it will be made available on the website. The questions and answers provided will be also implemented in a document, and this will be shared as soon as possible on the website. If you're interested, again, please visit the website, visit the marketplace to look for twinning originators or adopters, depending on what you're looking for. And yeah, thank you very much. Bye-bye.
Thank you.